In this video, we'll be working our way through blood pressure and understanding how the relative position of the blood to the heart is related to blood pressure. Okay, first of all, on this graph here, we see how the total cross-sectional area of the capillary bed is related to the speed that the blood is flowing. Now, this is pretty cool. Blood comes spurting out at a really rapid clip as it passes from the aorta and, say, into the subclavian, and then into the brachial, and then into the axillary, and then now we're down into the little vessels that are just supplying the capillary beds right here. Notice that when we go from the arteries into the arterioles, we really see a decrease in the velocity. So it isn't going quite as fast, really slow, because of sort of this delta, a river delta is what this reminds me of. Because we're dividing the blood into all of these other little passageways, it really slows it down. We can see as the nutrients and gases are exchanged in the capillaries, the blood is going just about as slowly as it's going to go anywhere else in the body, and so there's time for that exchange to occur. Then, as the rivers flow into each other to become these really large, relatively speaking, vessels, we see the blood starts to speed up again. And then when we make it into the veins, like the basilic and the inferior vena cava, the blood is moving quite quickly once again. Now, remember that velocity and pressure are related in this way. Look, even though we see things going really slow on this graph through the capillaries and then quickly again, because these vessels are so large, even though the blood is moving quickly, it moves at a very low pressure. We talked about this in the last video, the fact that our bodies have been really smart in the way that they lay out our circulatory system, putting the low pressure vessels on the surface and the high pressure vessels deep near to the bone. So if I cut my hand, the odds are that I'm only going to cut veins. And even though it might bleed, it's going to ooze out because the pressure in the veins is so low. If I have a really critical wound, a very deep wound, I might hit an artery. And look at this, the blood pressure is going to really drive the blood out. So arterial cuts are spurting wounds. Venous cuts are sort of oozing or dripping wounds. We'll come back to that in just a little bit. I want to make sure you guys understand how capillary exchange works. Wait one quick second. Going back to this, I just remembered. Which of these blood vessels has valves? The aorta? Well, yeah, the aortic valve. That's part of the heart. But which of these vessels has valves? No. Yes. Why? Why do the veins have valves? Because the pressure is so low that we would have a really hard time getting blood to flow uphill without these valves. Remember that? It's a really important structure, function, connection here as you start to try to put all of this stuff together in your own mind. We need those valves because the blood pressure in the veins is so low that we would be at risk for things beginning to flow in the wrong direction. Now, I just remembered I forgot to put something in our video, so let me show you what varicose veins look like. Sometimes when these valves fail, it can allow blood to flow in the wrong direction. Look at this. It's an excellent and informational graphic by the Mayo Clinic. Here we see a young and healthy vein, and the valves are all intact, allowing blood to move even at low pressure at a pretty good clip, pretty good velocity all the way back up. On this side, though, look, the valves have broken. Maybe this person was just gifted with bad valves. You know, we all have some genetic defects that we get. And varicosities tend to run in families too. It's also related to physical activity and maybe the amount of time one spends in a standing and stationary position. But anyway, I just wanted to make a quick clinical connection. Here we can see some before and after photos after they have gone in and surgically removed these. We can see a lot of distension here. Not only is this a cosmetic thing, this could be really painful as well. Tiny varicosities, sometimes called spider veins. These can be indicative of other issues, peripheral vascular disease, diabetes. But anyway, these are smaller, but all sort of the same thing. So wow, look at that. Some really amazing pictures on the internet. Look at this varicosity. Looks like a bruise, but it probably always looks like that, right? It's sort of like a whole network of spider veins. Varicosities that are ultimately the result of those bad valves. Okay, back to the task at hand. Here's the next amazing thing that we're about to learn. Our capillaries are leaky, and they are supposed to be leaky. By that I mean that things can actually pass liquid and nutrients, and in some cases small proteins can actually leak out of the capillaries. So here's the direction of the blood flow, arterial into the meta-arterial or thoroughfare channel, right? And then if these are open, blood flows through. And then imagine this, fluid leaks out. It was plasma, and now it has leaked out. It's not in the cell, it's not in the blood vessel, it's sort of between and surrounding all of these structures. We call that tissue fluid, or extracellular fluid, or interstitial fluid. All of these terms really mean the same thing. So why would we want our capillaries to be leaky? Well, they irrigate the tissues, right? This is how we sort of flush toxins and things out of our tissues. Sometimes our tissues get a little boggy. Sometimes we're retaining water, or we're a little, we have some edema. That's a whole bunch of extra tissue fluid, interstitial fluid. As we're going to see in just a little bit, most of that leaky fluid is actually sucked back in to these venous capillaries and then into the venules. So most of the fluid is recovered, but not all of it. And so in order for us to recapture all the fluid, we have to have this sort of like a little sewer system, a storm sewer, to catch all of this excess fluid and keep our tissues from getting too congested. The green tissues here are, of course, the lymphatic capillaries. They are the first start of sort of a parallel circulatory system to venous return. The lymphatic vessels capture this excess fluid and return that so-called lost plasma eventually back to the blood, way up here by the subclavian veins. You might know of the thoracic duct and the right lymphatic duct. Those are the largest of these lymphatic vessels, and that's where all of this fluid will eventually go, flowing back into the veins. Okay, so here's sort of the physics and the nitty-gritty physiology that we need to know about this leakage. We talk about this leakage as net filtration pressure. How much pressure is there resulting in this loss of fluid, this leakage, this filtration? Plasma is leaking out. Blood cells, by and large, are staying in the vessel. Here's what it looks like. We'll have to bounce back and forth between these different slides so you can really wrap your mind around it. But as our positive blood pressure is pushing blood through the capillary and on its way back to the veins, we have several different forces that are resulting in the net loss of fluid on the arterial side of the capillary and a net gain of that fluid, or you might think of this as recovery of that fluid, on the venous side of the capillary. This arc right here represents that tissue irrigation. So think about a wetland. You want water to slowly flow through the wetland if it doesn't flow, you just have a stinking bog. If it flows too quickly, it might wash things away. So in the same way, you have to kind of imagine that there are all these cells around this fluid that is circulating out and then back in. And in the same way that a fish tank pump circulates water, or rain and rivers circulate water through a watershed, this process helps to keep toxins from building up within your tissue. So the so-called fluid exchange is a very important process. Here are the different pressures that are illustrated here by the different arrows. This red arrow here represents the fact that there is positive blood pressure. We have higher blood pressure on this side of the capillary than we do out here in the tissue, and so fluid is being squeezed out of the capillary. This little blue arrow is representing the fact that there is a hydrophilic plasma protein called albumin. Remember albumin? Albumin likes water. Albumin is too big to get squeezed out into the tissue. And so it ends up creating what we call an osmotic pressure. Osmosis is sucking water into the blood vessel. Osmotic pressure, right here, osmosis, is pulling that tissue fluid into the capillary. Now, which of these arrows is bigger? Is there a greater blood pressure pushing it out, or a greater osmotic pressure pulling it in? Greater hydrostatic pressure is what we call it, right? Hydrostatic pressure is blood pressure. And so what do we see? A net loss of that fluid. Well, look what happens over here on the other side. Because we have less fluid in the blood, there is a lower blood pressure on this side and a higher tissue pressure on this side. This big blue arrow here represents the fact that on this side of the macaroni noodle, on this side of the capillary bed, the fluid pressure in the tissue is greater than the blood pressure. And so we're squeezing the fluid right back in. It's an amazing and elegant design if you really think about it, right? On this side where we want this nutrient-rich and oxygen-rich fluid to get squeezed out, it does move out. And on this side where we have waste-laden and carbon dioxide-rich tissue, we want this to get squeezed in, and it does. The balancing act is, of course, really the amount of albumin that's in the blood, and that osmotic pressure and blood pressure help to keep this working with 90% efficiency. Look at that, 9/10 of the fluid that's lost on the arterial side is recovered on the venous side. What about that last 10th? That's the job of the lymphatic capillaries. So if we go back here really quick, those green lymphatic channels are recovering that last 10%. Now, what happens if they get clogged? What happens if those lymphatic vessels are pinched some way? Maybe an infection or a tumor or scar tissue from a surgery, or the patient is morbidly obese, or whatever. There's some sort of a lymphatic issue causing pressure to go in the wrong direction, and they end up with edema. They end up with a lymphedema. Let me show you a super quick picture of what that would look like. Thank you, Google Images. Lymphedema. One big long word. And look at this. Here's a patient, a really remarkable perspective right here. I'm just making this up, but let's imagine that this patient had cervical cancer or bladder cancer, some form of cancer, and they had radiation treatment which burned shut their lymphatic vessels. Look at how important they are. They only recover 1/10 of the fluid, but over time that 10% really adds up, right? And so that's the one thing all of these patients have in common, is that their lymph vessels are not working right, and over time they get hugely distended. The fluid is not flowing through. They got a big old bog going on, right? This isn't flowing through the body in a normal way. Here we can see a patient who almost certainly had a radical mastectomy, right? We see surgical scar tissue there, and tissue that's healing. And so the lymphatic vessels that flow through the armpit right past the breast appear to have been damaged. And look at that, 10% over many, many weeks builds up to be quite a large and congested tissue. Now, what's the treatment for this? Can you just stick a needle in and drain that fluid off? No, because it's not really a central cavity of fluid. It's not like a cyst. This is pounds of fluid squeezed in between all of the cells. And so the best treatment is lymphatic massage. We have to try to correct the drainage, or maybe they're going to need a surgery to add some sort of a lymphatic bypass. And then medications and lymphatic massage, elevation, trying to use gravity to slowly decongest this fluid. Quite an interesting case. Moving right along. Unfortunately, this is some of the math that you'll need to be able to do. So not only do you need to understand the definitions of these terms, like hydrostatic pressure and osmotic pressure and net filtration pressure, but you may need to do some math. If I set up different scenarios where these numbers are different, you should be able to describe to me what's happening. Is there more filtration or less? Would there be tissue congestion? This video here on slide 40 can also help to improve your understanding of that complicated process. Speaking of edema, there are lots of other ways to get swollen tissue. Chemicals of inflammation, right? So if you've ever sprained an ankle or had a bee sting, that tissue damage sends off the smoke signals calling for help. Inflammation. It's really what it is. Inflammation is the body's response to tissue damage. And at the heart of the matter are chemical signals. Help, help, we're being attacked. We've been stung, we've been torn. Dying cells or injured cells release these chemicals of inflammation, and they really make the capillaries leaky. So you might think of, you may have seen a patient, or maybe you've seen a movie where someone has a severe allergic reaction and poof, their face swells up, right? Their eyes almost swell shut and they look like they're little puffy white eggs or something. And that is an excellent example. Anaphylaxis is maybe the most extreme example of how this inflammation can cause massive fluid exchange. Now, the problem with that one, of course, is that you lose so much plasma into the tissues. Not only are you swollen, but your blood pressure goes through the floor, right? Suddenly we don't have plasma, we have edema, and en masse, that results in a serious hypotension. And then the heart's response is to start to beat more rapidly, and then they lose more fluid because of that net filtration pressure, and then they get into this sort of death cycle. Blood pressure falls, heart rate goes up, blood pressure falls, heart rate goes up, and eventually the heart just gives out and they go into heart failure. Decreases in plasma concentration of protein reduces blood colloid osmotic pressure, and more fluid moves into the interstitial fluid. This is all about albumin. Albumin helps to maintain this blood colloid osmotic pressure, which is what this little blue arrow is. And if you are a severe alcoholic, or you have hepatitis, or you're so malnourished that you don't have enough protein in your diet, then you begin to lose the pull from albumin. And then there's nothing to counteract this one. And then we see a different type of edema. This one is sometimes called borborygmi. I'm not really sure how to spell it, but that's something like that. Borborygmi. Oh my gosh, what am I doing? Anyway, this is a swollen belly that we sometimes see in little starving children, or in alcoholics who just are really at the end of their disease process. Big swollen bellies, right? Okay, next, blockage of veins. Increasing capillary blood pressure, reducing venous return to gravity. So this is what sometimes happens with older people who stand for a living, right? The vein getting compressed by a tight belt, perhaps, or a machine that they lean up against, or that can actually cause venous backflow, blocking the return of the blood, and then we see tissue congestion. Then the other one, we had already seen this, a lymphedema, blockage. Elephantiasis is, of course, a tropical parasite that leads to lymphatic blockage, and you can see some really remarkable pictures on the internet if you search for that term. Moving right down the line, venous tone, the continual state of partial contraction of the veins as a result of sympathetic stimulation. Okay, in plain English, your sympathetic system is zapping the smooth muscle in your veins, and it's sort of like if you partially contract your biceps, like don't make a huge muscle, but just sort of contract it halfway. That's what your veins are doing right now. And so if you lay down and then stand up and then lay down again, that change in gravity will cause your veins to have to tighten and relax in response to your movements and gravity so that you can continually maintain homeostasis. Got to keep your blood pressure up. Got to keep blood flowing to the brain. And if I start to do yoga or cartwheels, boy, my body better respond. And that's what venous tone really talks about, this continual state of action and reaction. Think negative feedback loop, think homeostasis. That's what this is all about. There are several different ways that we can control blood flowing into the tissue. There is a supply and demand concept here that is really talked about in this local control. Blood flow is proportional to the metabolic needs of the tissues. Think about this. Your grandma probably told you at one point, don't go in the water until a half an hour after you had lunch. Well, there's actually some logic and wisdom in that. When we are digesting our food, the metabolic needs of our stomach and GI supersede. They overwhelm the need for our muscles. And so you don't want to go swimming because you got all this blood in your belly trying to digest and absorb your food. Likewise, when you are swimming and you're out there playing and really using your skeletal muscle, then blood is redirected to those tissues which are most active. When you sit and study, when you're thinking about these physiological concepts right now as you're listening to my voice, your brain is actually burning tremendous amounts of energy. So maybe that's the silver lining of this class. You're going to lose weight. You're going to lose weight from stress, and you're going to lose weight because you're actually burning calories thinking. And so here's a really cool related idea. Now that we understand that blood flows to the regions that need it the most, scientists have figured out ways to measure that change in blood flow in the brain. Look at this. It's called a functional MRI. PET scans work in a similar way. But look at this. Amazing. We can use these high-resolution functional magnetic resonance images to look at changes in blood flow within tiny regions of the brain. So look at this. When I am talking right now, when I'm trying to lay out the story, when I'm trying to think of what I'm going to say next, certain regions of my medial prefrontal cortex have to speed up their activity, and so there's more blood flow to that region of the brain during that type of cognitive task. After I finish this video, I'm just going to sit down and have a cup of coffee, and different parts of my brain are going to light up, right? Here in the insula, I'm tasting the coffee, and here maybe I'm a little bit more in the moment and sensing my body and the world and not so much thinking about what I'm going to say. So anyway, I think this is a great example of local blood flow control. The autonomic nervous system and hormones aren't necessarily coming into play right here. It's just supply and demand. One part of my body is really busy and it says, hey, send more blood here. Other parts say, yeah, we don't need it right now. So that's what we mean by local control. The nervous system we've already talked about, and we'll see some feedback loops in just a little bit, showing how in times of rest and relaxation we can put on sort of one blood flow schema, sending blood to the digestive tract and urinary tract. If there's an emergency or something very stressful, we can go into a totally different blood flow pattern, sending blood to our brain, to our muscles, to our heart and lungs so that we're ready to run or fight for our lives. Hormonal control, this one's a bit complicated. We'll have to look at this in a little bit. We're going to be talking about renin and angiotensin and aldosterone. These are more long-term blood pressure control as it relates to how salty your blood is and maybe how much urine your body is making. Here's the biggest physical connection between this idea of local control. The local control allows blood to really surge into an area when it really needs it. And look at that, you can see a 7 to 8-fold increase simply as a result of the changing in the diameter of those meta-arterioles. And we get to talk about these tiny sphincters for the very first time. These are so important. Remember what a sphincter is? It's like a muscular doorway. So you might think of the pyloric sphincter or the upper esophageal sphincter. These are just the same, except that they're super duper tiny, and they are surrounding the true capillaries. So as we look at this image here, when those pre-capillary sphincters are relaxed, blood flows through the capillary bed. Yeah, it's flowing through the meta-arteriole, but most of the blood along the way gets redirected and circulates through all of these true capillaries. But look at what happens. If the pre-capillary sphincters are closed, blood can't get off of the main thoroughfare. It's like there's a parade and you just can't get out. You got to go on the main road and they don't let you into the neighborhood, right? So here's a great example. When I'm cold, my body wants to keep the body temperature in the core. And so many of my peripheral tissues turn very pale. The precapillary sphincters in my skin close off to try to keep my core, my brain, my organs nice and warm out in the cold weather. And so I look ridiculously white. I'm a really pasty white guy anyway. And when my skin goes pale, man, I look like I'm dead. I am a ghost. Likewise, when I go running, because I don't have much pigment in my skin, like melanin, my skin has to flood with blood to try to radiate the heat. And so in the skin in my face, the precapillary sphincters all open, and it floods my skin with blood. And I'm not joking, I turn so red when I go running that people have asked me if I'm okay. A little personal disclosure there. Okay, so that's all you really need to know about local control. You might want to pause the video right here. There's a lot to think about.